Hi, everyone. I'll wait 2 more minutes or one. There he is. Don't even have to wait. Hi, Jack. So with that, at
How you doing?
5:02, we will open the January 2026 Board of Health meeting. Happy New Year, everyone. In attendance is myself, Risha Hess, Premila Nair, Betsy Brooks, and Jack Jemsek. That is all of our members, so we are all here. We are also joined by Kiko and Maheen from the health department. So, um, the first item on the agenda is to review the minutes from December. I did not have any comments. Any comments or corrections that anyone else noted?
None for me.
None for me either.
Yeah, I'm good.
All right. Yeah, they were very thorough. Thank you again to Nancy for those notes. Okay, so motion to accept and pass the minutes from December.
So moved.
Mhm. Second.
And all in favor? Betsy, I'm going to
Aye.
assume since you moved, you're
Yes.
in. All right. Great. So just in case others have who are attending and haven't seen the agenda, we will start with public comment now. We will then discuss the Kratom regulations, Kratom regulations, uh, board priorities as part of new business, the director's update, topics not anticipated by the chair 48 hours prior to the meeting, and then we will have another public comment at the end. In our public comments, we cannot engage in discussion or respond to them. We will just note them. And Kiko, I always forget, is it 2 minutes? Is that or 3 minutes?
Usually it's 2 minutes, excuse me, for public comment in a board meeting.
Okay, thank you. So we'll limit your comments to 2 minutes. So I will now open it up for public comment. If you want to raise your virtual hand, we will promote you to panelist and you will be able to be heard and seen. And please introduce yourself at the start of your comments and where you live. I am not seeing any hands. So if anyone wants to do a last minute hand, otherwise we will move right along. I see that there's a new attendee, and so I just want to acknowledge that it is currently comment time. If anybody wants to make a public comment, please raise your virtual hand. Okay, we have another public comment at the end of the meeting if anybody has anything they want to say at that time. So we will move on to our first order of business, which is the Kratom at Home regulations. Hand over to Premila and Betsy.
I reviewed the addendum that Maheen sent today, and essentially the difference between this and the old is that it addresses all kratom as opposed to synthetically derived kratom. And I mean, I listened to the meeting where they made this decision. It was the October 16th decision of the Northampton Board of Health. And basically, they were listening to the inspectors that had gone around in terms of making a preliminary pass to see if, well, to distribute and to see if people had any questions and so on and so forth, the retailers, I mean. And they found, although they weren't able to look at every retail establishment, they chose the ones most likely to have Kratom products. And none of them had naturally, well, maybe one had naturally derived kratom. Everything else, there wasn't a lot, but it was synthetically derived. And so their feeling is, initially they've been concerned that there might be a groundswell of locals objecting to a ban and saying that they need to have it available. And their thought was, as long as that isn't true, it makes sense to prohibit it until information comes to say otherwise. And in the meanwhile, it is available on the internet. They did not want to encourage people to start using just by seeing it on the shelf. And then also, if the FDA comes out with info about benefits or how not a danger kratom is, then they would reconsider. But in the meanwhile, they felt like it just made sense, not to exempt kratom in its natural form. That's it in a summary. You certainly could listen to the meeting, and I can tell you, at what minute point in the meeting they discussed this, but.
And where are we on the recommendations from you and Betsy as to how we should fall?
Well, we drafted them and passed them on to Kiko and Mahin. So essentially, we were proposing the same as the Northampton regulations. However, there were a few points of clarification. I think Betsy mentioned them specifically in her email to you, Kiko.
Let's see. I'm not remembering that. Oh, let me just look at this email. Yeah. So you recommended following the Northampton Board of Health regulations. Had I had a chance to discuss enforcement with Meredith, I tried to get in touch with her. She was on vacation big chunk of time over the holidays. So no, I haven't had a chance to talk with her about that. I think I answered these questions in an email to you. But in terms of I'll move on to the relevant questions. Do the educational flyers mentioned exist? I think Northampton has developed some educational material. I think they would be happy to share it because we're part of the, Public Health Excellence Shared Services arrangement with them, and this falls under that work easily.
They actually had an example at the meeting that I listened to. So
yeah, right.
It's in place. It would be easy to get it, I think.
Yeah, I mean, I think we want to see it's usually they develop really good materials. Maybe one or two tweaks would be needed, but certainly it's a great template to work from.
Yeah,
and then I think
that is that they said when you sell them, you must also give out the educational materials. If they're fully banned, both the natural and the synthetic, we don't have to worry about that, correct?
Yeah, I don't know what the educational materials cover exactly. So yes, I think that was another point. And Premal, thank you for that summary. I'm glad that you were able to watch the meeting. I also watched it and found it to be very helpful. But I think the other thing that they talked about maybe in prior meetings was just how difficult it was to differentiate between natural and synthetic. Like some packages didn't have all the information on them, it was just really hard to be able to say this okay, this not okay. And especially since they didn't see very much that looked like natural kratom on the shelves, it seemed like a more sensible thing to just enact a total prohibition. Mm-hmm. So in terms of educational materials, would they be needed? I don't know. We'll take a look and see what they've been using. But I did want to say that it might be valuable for us to go out into the community and see what's on the shelves, because we haven't really done that. Mm-hmm. And I think that's an important thing to understand, like what's our community context with respect to the products that are currently available.
Yeah, I went to the nearest service station and they didn't have any product of any type.
Okay.
Yeah, I think just as Northampton did, if it's feasible, giving staffing, I think it behooves us to, go out and look and see what's there and inform ourselves and then make a decision about synthetic versus all forms.
Yeah, But I think the current Northampton regs did not talk about the educational materials, probably because they said they should be available where the product is sold. And if it's not to be sold anywhere, we may want the materials for other reasons, but they don't, that question about how the vendors get the materials and who's responsible for seeing that they have them is irrelevant.
I think that, yeah, the plan, I think initially was to have the retailer pass them out, but also use it to educate the retailer as well.
Yeah.
Can I just acknowledge that we do have someone with a hand up. We don't take public comment during discussions, but I don't recognize the name. Is Kiko, do you recognize this as someone from the Department of Public Health or? Okay. So sorry to the person with their hand up. We cannot take public comment in the middle. We will have a session at the very end for further public comment. Okay, so right now the proposal on the table is to have the inspectors go out and take a look at what's on the shelves to determine whether they would be able to adequately differentiate if there was only synthetic was banned or if there are any natural products being sold in our town. Is that the proposal, Premila?
The other possibility is to work on the synthetically derived kratom prohibition currently while we're waiting to collect information about the availability of the naturally derived products, and then we can always do a memorandum, amendment as Northampton did.
Or we could follow Northampton's guidance, what Northampton ended up, and say that we're banning all, and we'll see whether in fact there is a wide availability of the natural product in Amherst, in which case we would amend it. We would consider amending it to allow that to be sold.
So yes, we could take either the more restrictive or less restrictive version of Northampton's and pass that. So it sounds like there's a draft going around. I'm not sure if I've seen it. So we wouldn't be able to officially vote on it. We could vote on what we want the overarching tenets of it to be.
Yeah, the version that would be the more restrictive view would be the one that I think Maheen circulated on yesterday's.
So just copying Northampton's.
Yeah.
Okay. I think though to actually vote on something, we would have to have it without, for us, right? Is that true, Kiko?
I think that would be a better practice to have a draft regulation that references Amherst, that's based on the Northampton template. So to me it feels like, because we don't have that, and because we've agreed, or you all have suggested, that we do a little bit of research, that it would be best probably to wait until a subsequent meeting to vote on this, but I think there's more consensus maybe that you need to get from everybody about where we're headed with this. Jack hasn't chimed in yet.
Oh,
Go ahead, Jack.
Go ahead.
I'm pretty, I know, could do a little research on my own on this. But I'm pretty much, deferring to the medical folks here on the board. So, I don't really have any comments above what has been stated. So,
Kiko,
So
feasibility?
go ahead.
Sorry, I'm sorry. I just wanted to say, I wonder what is the feasibility of having inspection staff go out and look between now and the next meeting?
Yeah, I think that it would be, I think it wouldn't be inspection staff, it would be public health staff, but it's not, we don't have that many retailers. I think we could do that. I think it's reasonable. If we promise to do that, we can do that. And we can also make a draft of the regulation, depending on what you all decide, whether you're going to go more restrictive, less restrictive, the template that Northampton has shared. We can do that and have that ready also for the next meeting for you all to consider. That would be fine. I think we can manage that.
Yeah.
And I invite any of the board members to come with if you're interested. You know, we can let you know when we're going out if anybody wants to accompany us. Not requirement, just a suggestion.
So just to agree with what Prema said, there was overwhelming evidence that the hydroxy project was very addictive and very unsafe, and no question should be, that the synthetic should be banned, and that the problem was that and so unless there is a significant natural freedom that have an audience, I totally agree. And just
Betsy, it's quite hard. You're cutting out quite a bit. I'm going to repeat what I think you said, and maybe you can just correct anything that I have gotten wrong. So the evidence out there for the synthetic version, sorry, I'm not going to be able to quote you exactly. I don't recall your exact wording, but the gist of it was, if I understand correctly, the point you're making is that the synthetic version is quite harmful and addictive and should be, in your opinion, regulated. And the question remains as to how much naturally derived, as Prema has been calling it, product is out there, if we should be trying to ensure access continues for anything out there. And that seems to be the last remaining point. Did I generally get your point across?
Yes. Yes.
A bit, sorry, go ahead, Eurisha.
No, go ahead.
Well, I just wanted to say, and I'm not sure if we're at this point yet or not, but we could, if we're essentially working with Northampton's regulations, which seem pretty thorough, we could do two versions, and then based on the input we get at the next meeting, vote and to move it along, basically, whether it's just going to be synthetically derived Kraton products or all Kraton products. It's a very small, a very minor addendum to the original, which specified only synthetic products. So that seems to me to maybe not delay it any further.
Yeah.
I think procedurally, if we have one or the other drafted and ready for vote, I think we could vote to either add or subtract if we didn't like the one in front of us and move and take the vote at that time. We wouldn't have to have both specifically drafted. But yes, I don't think it's there's not many line items of difference in the two.
Mm-hmm.
So let me just try to understand for my own sake the argument. I think, and this isn't a vote, this is just what I think I've heard from everybody in past meetings, is that we're all agreed that the synthetic should be banned. And I think the remaining question is whether or not the naturally derived. And we have heard many arguments. We got 2 more written comments that were shared with the packet this month from people who really support the use of natural products. And I'm just going to say this for the public meeting portion. I know you all know, particularly for a harm reduction type of use for pain or addiction, that people have found it very positive. I'm probably not making that argument as robustly as they are. And that, so therefore, many localities have just banned the synthetic, which has much more dire research around it.
Actually, can I just interrupt that?
Yeah, please.
That's not actually correct because, well, from what I heard of the Northampton board, Meredith did some research, and I think that there are 7 communities in Massachusetts that have banned kratom, and none of them make a distinction between synthetic and naturally derived product. So,
okay. And so the pros for keeping the naturally derived product on the shelves is that there may be health benefit to using it. And there isn't to my knowledge and what has been shared, I have not seen evidence that that particular version causes the harms that we're most worried about. On the side of more of a blanket ban, one is just the ease of inspection and regulation, that it's very hard to tell because there's not labeling requirements. It's very hard to tell which is which. And it would be pretty easy to make something look a little more natural, and therefore hard for both retailers and our inspectors to make proper decisions on those. And to Northampton's argument, if it's not actually there, there's no need to be encouraging it to start being there, I guess, is their argument. Does anyone want to add anything to those summaries on the pros and cons of sort of having the naturally derived substance available?
they weren't advocating. It was a significant point to them that if there were people that still needed it, they would be able to buy it online.
And they weren't currently buying it in the town.
Correct.
Yeah. All right. Well, I am fine with does anyone want to make any other comments on the sort of points? I see Jack and Kiko. So Jack, go ahead.
Yeah, I'm just wondering if do health professionals, they don't need to write prescription, but are they writing recommendations to patients for the natural kratom or not?
Not that I'm aware of.
I don't think it's considered an evidence-based. It is not considered an evidence-based treatment.
Mm-hmm.
So healthcare providers do make recommendations off of, outside of the medical evidence all the time. But
yep.
So it would be outside of the standard. No one's trained to recommend it if they see XYZ symptoms.
How is something like CBD or cannabis treated? Is that evidence-based, or is that in the same category, or is that?
I think at the moment one would say that there are some cannabinoids that do fall into evidence-based treatment guidelines, but it's very, very limited and not predominance of the usage. It's a very small portion of the usage.
But I think to that point, Jack, we know that before it became legal in the state, doctors were absolutely writing prescriptions because that was the only way it could be gotten. So that's why I say we know doctors write prescriptions outside of those guidelines or make recommendations outside of those guidelines, but it's not, neither is fully inside the guidelines at the moment.
Right.
Yeah, I guess I just would add, I do feel like this is kind of a state, policy or here we are, they can order it online and here we're trying to kind of make checks, locally, but it just seems ineffective.
Thanks.
It's a stopgap for sure. This should be a
Yeah.
federally determined, there should be testing and there should be recommendations and it should be scientifically based. I think we're a little too early in the US's use of kratom to have, so they've started to make marketing recommendations, but they haven't gotten down the path. So it's a stopgap. And I think if the evidence came out that said had beneficial and the pros outweighed the cons, that we would have to revisit these guidelines.
Yes,
And I would also add that as a physician, I received a letter from the FDA talking about the extreme risk of the synthetic kratom products.
Pramila?
I was just going to say that I think, the hope, I mean, this is the second time that a bill to regulate kratom has been brought up in the House, but who knows if they'll get to it or not. They did not the first time. And certainly if there's more evidence, we can revisit this. I think the idea is to protect the public, especially young people, from just seeing something on a counter or on a shelf and deciding to try it when in fact they had, the people who are kratom naive, I guess is what I'm trying to say. So if it wasn't available, whereas the people who have found it beneficial still have an avenue for obtaining it.
And I think to Betsy's point, there have been some very serious risks identified in the synthetic version. And right now, anybody of any age can go in and buy the product because there's zero regulation on it.
Right. And so I think the faster we move on this, the better.
Yeah.
So
Pico,
my points were just about enforcement, because that was something that you'd asked about, Pramila, you and Betsy, in your email, whether everyone felt okay about the enforcement outlined in the Northampton template, or if that was something that needed to be discussed. That was one question. And before you get to that, I just wanted to acknowledge, first of all, I see that Melody's
right over there. How are you?
So Betsy, can I remind you to unmute yourself if you're not talking?
Sure. Let me see how I can do that.
Oh, you should be able to do that on your phone with the mute function, hopefully.
Yeah.
Okay, thank you. So Laura Romney, who raised her hand earlier, is somebody who is a kratom advocate and has reached out to us before. Her comments have been sent on to you in the past. So she is not an invited speaker here tonight. She is welcome to make some comments in the public comment at the end. So I just want, and same for Melody, who has their hand raised, comment at the end, not now. This isn't the time for public comment. So then again, the question about enforcement, excuse me, and if there's anything that the board wants to discuss around that.
And by enforcement, are you talking about particularly the fines?
That whole section, yeah, the enforcement and penalty section. I think Betsy and Pramila had questions about whether that should be revisited at all.
Pramila?
Sorry, I was muted. Given our staffing, what that looks like in terms of inspection services, I guess, to begin with, and then there is that larger question of penalties and fee structure and so on and so forth.
So I guess the question that we talked about a bit earlier, several meetings ago on enforcement and capacity is just because these aren't licensed venues, are there people going into these venues regularly that they could add this on to what they're currently looking at? Would this require a sort of additional mandate for people to increase inspections? And if so, do we have that capacity?
So I think this was one of the things that Betsy and Premila suggested I talk over with Meredith to see if there was capacity as a result of the shared service arrangement for their inspectors to do any of this, because they do it in Northampton, but they don't do it currently for us here in Amherst. And our inspectors don't do this here. So I think it's within the public health department's jurisdiction to go out to entities that have tobacco sales permits. That is something that public health should and could and should do. And many of those same retailers are the ones that carry this product. If the product is on the shelves of other stores, convenience stores that don't have tobacco sales permits, then we don't really have kind of a mechanism for going into those to inspect them.
Okay. And would that shared Northampton resource do that if that was available?
I'm not sure. I would have to ask them.
Okay.
I mean, I think they do that in Northampton. They do inspect retailers that do not have tobacco sales permits, but that's not something that we do in Amherst because we're set up differently.
Okay. I mean, again, we are small enough that it might be enough to do the tobacco licensed venues, and then the rest of it would be based on reports. So if people saw it somewhere and wanted to, basically make a report, we could go and confirm, and or staff from the public health department would go and confirm, but not do sort of spot inspections. Does that sound right? Okay. The Northampton fine structure is $300 for each offense. So first offense, 300, second offense, 300, third offense, 300. And from the second offense onwards, then they lose all Board of Health permits for 330, and then possible complete revocation of all licenses. Really, that's alcohol and tobacco, right? Those are the only two that would likely be, or I guess if it was a restaurant.
Yeah, or a convenience store that doesn't sell tobacco but has a Board of Health permit to sell other things, like, I don't know, roast chicken or what have you. They could have food permits. Other stores could.
Okay.
That could potentially be affected by this. Yeah.
And I think I don't have Belchertown's open in front of me, but I think they had more like a 1,000, 2,000, 3,000 fine structure. So much higher and also different at each offense. Betsy and Premila, did you have thoughts on which of those structures you preferred?
My own sense is what seemed most feasible to the staff, because wanted this to be something that was easy to enforce and well within the scope of available resources.
I mean, if we get to that 1,000 structure, are we back in the problem that we had with tobacco of how we issue those fines?
Yes.
So recommendation would likely be, let's keep it under 1,000, whether it's 300 for each, or if it goes up progressively for second and third violations would be something we could discuss.
Yeah, I would recommend no fines over $1,000. Yes. It also seems that given that we're sort of just stepping into this arena, it might be better to err on the side of caution, start with something a little milder, like what Northampton has done, see how it goes. Maybe it needs to be changed if there's a lot of egregious stuff happening out there, which I don't anticipate, but that seems like a sort of more reasonable way to start this.
I also think that revocation of a license, for instance, losing a tobacco license, losing a liquor license would be a much higher threat than any version of these fines. So that is something we could consider to keep the actual fine fairly low, but then that possibility of losing your licenses for a few days or more.
I would agree with that formulation.
Okay. I mean, that's what Northampton has, and I'm sure I'm just repeating what their logic was there. All right, so maybe the draft on the table then is to match Northampton's fine and enforcement structure. Was there any other piece of this that caught anyone's eye in terms of enforcement?
So for me, not enforcement, I think we've covered that, but I also want to remind the board that this regulation that Northampton has put together does also include synthetically derived cannabinoids and unregulated novel intoxicating products. Very broad language. And is that something, Betsy and Premila, that you also had thought this board would replicate?
Speaking for myself, yes, but again, there's an issue of enforcement, so. But in terms of safety and the public good, yes, I would recommend that we add that.
I think I agree. There's a sort of whack-a-mole kind of thing where things change very slightly,
Mhm.
and then it can escape falling under the regulations.
And this, I mean, I think they
This
worded
is-
it deliberately broadly for that reason.
That's correct. That's why the broad wording. The other thing I wanted to mention, excuse me, about this is that the synthetically derived cannabinoids are illegal products per the state of Massachusetts. So you don't have to, as a local board of health, write a regulation about them. But from an enforcement standpoint, if we're talking about Kratom, we're going into these same stores that have these same things on the shelves. And these things are on the shelves. I've seen them on the shelves in Amherst, and they should not be on the shelves. And there hasn't been, we could have enforced it all along because it's state law, but it's just, it gives you a little more teeth if you also have it in your local regulation. And then with that broad language about the unregulated novel intoxicating products, just gives you even more leverage to monitor things that might pop up in the future that could potentially be harmful.
That makes sense. I was going to ask if it's already in the state, why bother putting it locally? But if you think that it helps, what does it do to penalties? The state have overarching penalties for?
There aren't penalties for it. It's one of these really unfortunate gray areas, and it's something that's very complicated. And that when I read up on it the last time I was diving into this a year ago, I was really conversant on it. Now, not so much, because what's hard about this is that there's Delta 8, there's Delta 10. Some of them are configured in different ways. There's a loophole in the farm bill that makes these products supposedly legal, but not really. Anyway, I'm doing a terrible job articulating it. But all that to say, I think it's really helpful to have this broad language that covers these products that we know can be harmful and that are on the shelves.
And we would be adding a fine structure that's not currently
correct.
in
Thank
place.
you. That was your point. Yes.
Okay. All right. So it sounds to me like we should, and Kiko, I think you offered to do this. If you didn't, please correct me. Take the Northampton current ones that have a larger remit on ban, draft for Amherst. Concurrently, your team will go out. I would like, I don't know that I want to go with you guys because coordination can be difficult, but if you would share the list and give me a few, or I can volunteer which ones I want to take. I would like to do that because I'd like to see, particularly since the one I went to didn't have any. Now I'd really like to see what they look like. And we will come back and have a better understanding of what's actually out there, particularly around the natural. And for your team, if they can take pictures of anything that's found, because I think to Premila's point around enforcement, how confusing is it to tell what's what? I think that would be helpful. Anyone want to make any further comments on this topic? To the board, I'm speaking to board members, not general public in that question.
I'm just curious, do we have any incidents related to this locally that you're aware of, Kiko? Not
There was the
incidents with
person
regard
who,
to misuse, I guess is what I'm saying, or people that have become ill.
I recall the person in Northampton that testified. Were they a Northampton resident? I don't recall how local they were.
Yeah, I'm just reading. Yeah, someone had a seizure. Um,
Was that person a Northampton resident?
There was also a physician who from Northampton who talked about her son having
Yeah.
had a very negative reaction. So, I guess the question would be, what do you define as locally? And what would be a significant reaction?
Primala, wasn't there a death related to it in
Yeah,
North?
there was. I just don't remember if that was local or not.
I thought it was, but I wouldn't.
It could have been. I would have to go back to the minutes to see. But the information is certainly available there. And when it was discussed, there certainly were examples of negative reactions.
And Pramila and Betsy, as our resident doctors, do you know the regulations on what is supposed to be told to the town? Obviously, deaths would get recorded, but if somebody had a reaction, would that be reported whether or not we knew what the cause was? Because I guess my question is really, how much would we really be hearing about this unless somebody wants to make an active sort of complaint or testimony?
To my knowledge, there's no reporting requirement, so there wouldn't be a way that.
Right. So of overdoses of anything, does that get reported, Kiko?
Yeah, I mean, opioid overdoses get reported. If they're in a clinical setting or in an ambulance or something like that, if a paramedic is called, then that gets reported as an opioid overdose. Other substances, no, not that I know of. Yeah.
I'm just reading here. There's something to think about, that Springfield Health and Human Services spoke against the proposed ordinance because they couldn't test for that synthetic compound. And so they felt like it was unenforceable. This is a December 30th.
And would that be that they couldn't distinguish between natural and synthetic, or that they couldn't distinguish between kratom and some other substance?
Well, I guess,
altogether?
there's labeling, but if it's repackaged or whatever,
Or they just don't have the capacity to test?
They said it just doesn't have the means to test the products for the synthetic.
Okay.
So,
Yeah.
I think, if I recall correctly, in Northampton, essentially how they were distinguishing the natural from a synthetic was looking at the ingredients. And it either was just kratom, or if it had anything else, then it was considered possibly synthetically derived, but in any case with additives. So that's how they were making the determination, the inspection team.
Yeah.
Yeah. So Springfield, just to finish that, they just said that they agreed that need to be removed, but their Health and Human Services suggested working with the state and federal FDA, both of which are working on banning synthetic kratom. Yeah. How do you say it? Kratom?
Yeah. Kratom.
Kratom?
Mm-hmm.
Kratom.
Which I
think that, go ahead, Betsy.
And for I was going to say, which I guess is sort of an argument for the more comprehensive ban because it doesn't require distinguishing the synthetic from the natural product.
Mhm.
And I was going to say, even adding in the synthetically derived and unregulated novel, I mean, at that point, you don't actually have to know that it has kratom in it,
Mhm.
as long as it's likely to be in one of those categories.
Mhm. And I think as far as enforcement goes, nobody in Northampton was talking about testing products per se. So,
Yeah, I guess, when who is putting the label on the product, and, where are the checkpoints for the accuracy of the labeling? So,
Yeah,
Right.
uh,
Yeah, there isn't, because it's falling through the cracks.
right.
yeah,
It's not hitting this one or this one or this one or this one. Now they did have the FDA marketing approvals, which I think then allows some of the labeling, but if Joe Kratom maker in a lab wants to package his own and put it on shelves, I don't think it would hit any barriers from a health regulation standpoint. Which is why we're doing this. And again, yes, it should be federal and then it should be state. But until those things happen, we'd like to make sure they're not
mhm,
on the shelves.
mhm.
I do find it interesting. Belchertown is the first town, and we know how they felt about the tobacco-free generation, but they're the first town to have banned it.
Yeah. It does seem like it's making its way around the state, though.
Yeah.
All right. Shall we move on from that? So I think we have a way forward if everyone's okay with that process. We will draft regulations for Amherst based on Northampton's and simultaneously go look at what's out there and come back and hopefully vote on this next month. Okay. The next item is around board priorities. Just want to take a quick check on time. So this conversation is just about, where do we go from here? We don't really have any other pending policies that need to be looked at. We don't have anything that's under review. And I think we've, discussed in the past being a little more proactive on topics that we either think are urgent and need our attention or are of interest to individual members. I had put together a summary of that. I had looked at it with the eye of one thing we could do on some of these topics is see what the other town councils, town boards, council's the wrong word there, town boards are doing, and see if there's a way to join forces. But there's other things we could do, even if there isn't another board that's relevant. I did add the sports betting, and I didn't add e-bike specifically because I did have biking and walking infrastructure in there. It's not quite the same thing, but it felt like it might be part of the same genre, so I didn't add a separate line for that. Do people have things that they would really like to dig into in the next 12 months? Obviously, understanding what everyone's time and energy is. Yes, Jack.
Yeah, I did talking with Kiko around the holidays, want to commit to doing the revision of the well regulations. That really shouldn't be a problem, but I need to meet with Kiko probably and set some dates and for drafts and things like that.
Yeah, I mean, that's something that we've been talking about. And as Jack said, we mentioned when we saw each other, we just need to sit down. So we're a small working group. really Jack is the person with the expertise in this area. And we can also pull in inspections and just kind of look at what we currently have and then make a proposal of what things should come before the board, what things can be sort of more automated for inspections to just sort of sign off on without the board weighing in, and then bring that. So that could be a couple months work, like maybe in the summer, Jack and I in inspections can present some proposals to the whole board to sign off on and make changes to those regs. So that's very kind of in the weeds, environmental health stuff, which we can manage, I think, the two of us. And then you have these broader things, Risha, that are in your grid.
And just, Betsy, in case they aren't in front of you, I'll just summarize them. And for anyone listening, we have water supply and fluoridation, wastewater, mental health, defibrillators being more publicly available in more spots, Puffer's Pond, which includes both sewage and fats, oil, and grease regulation, which is something that other towns have that we don't, health equity, immunization, ticks and mosquitoes, overdose, compost, primary care shortage, walking and biking. I put it as gambling. It was raised as sports gambling more specifically, and then other. Are there any others that people are feeling like they'd like to dig into this year?
I can.
Do you want to?
Yeah, let's have Jack go and then Betsy.
Yeah. You had the question marks on the Water Supply Protection Committee for the fluoridation, water supply, and then wastewater. Can I help clarify what?
Yeah, does that committee address either of those?
Well, I mean, yeah, so the water supply, yeah, they are addressing as a public water supply thing. They are outside of our jurisdiction, I would think, because we're dealing more with private wells, but they are under the state supervision. So there's all sorts of protocols that they have with regard to testing and notifications and things like that. But it's kind of, it's self-implemented by the DPW and the water department there. We do
and I
check
think
in.
It might be worth just reiterating what this chart did, because it might not be the best jumping off point, but it was looking at, if we wanted to do something, are there other committees that it would make sense to reach out to and say, hey, we're looking at the fluoride regulations. Does it come up with you? Do you have anything to do with that?
I agree there. That I know has not come up, except maybe I might have mentioned something. But yes, so that would be good to formally kind of have a task group on that, perhaps, and to review.
And wastewater also. Oh, sorry.
Oh, the wastewater that's with that is stormwater. They do a lot of testing through what's the program called? But because of all the outfalls and things like that, they do an amazing amount of testing to make sure the surface water runoff. Fort River, I think, receives the majority of it locally. But so they're doing that testing, and then they obviously have the wastewater treatment plant there right off the UMass campus. That again is all kind of self-implemented by them, and I'm not sure. I mean, personally, because of Fort River, people are go swimming in there actually, from time to time. It'd be good to know what they're doing. So, but again, they're addressing stormwater and the municipal wastewater, which is a single outfall after it's treated and collected, and it's discharged to think the Mill River, no, not Mill River. Well, it's up in Hadley. Can't think of the
Okay.
name of the river, but so again, our oversight is more for private septic systems. And when it
But
comes to
if
stormwater, that's usually Conservation Commission is looking at sort of thing with construction sites. Yeah, you might want to put a check there on
yeah, I agree
stormwater,
with that.
wastewater, and then maybe check the Conservation Commission for that.
Yep.
Agricultural
So
Commission is they don't I think that I don't even know that if they're meeting. I remember on the planning board when I was there that there wasn't a lot going on. So
okay, that's helpful. Thank you, Jack.
yeah.
I'm making those changes. Betsy, you wanna?
Sure. Two things. If there is any need to, to look at the fluoride levels in town water, I'd be happy to do my homework on that and weigh in on that. That seems a pediatric issue. So I do feel like the issues on the cardiac resuscitation and whether the ECTs, the AEDs are available and use. That is something I feel very interested in. One of our neighbors was a young teen who died with a cardiac arrhythmia that had that would have benefited from AED use. There was a recent arrhythmia leading to a near-death experience at Bay Road Tennis just at the end of the year. And my daughter in her 30s recently lost a friend who developed an arrhythmia while eating at a restaurant and died a brain death following the arrhythmia. So I think this, on a personal level, kind of understanding where we have public AEDs, whether the knowledge of them and how to use them is widespread. I think that's a project that I would put some work into. I think it's important. I think I had
Jack?
mentioned to people.
Oh, sorry.
I was going to say, I think I had mentioned to people in this group that I was walking with a friend from out of town who suffered an arrhythmia and required a cardioversion on the bike path. And happily, she was attended to within 2 minutes and was up doing the Wordle at Bay State Medical Center that evening and has survived. I think these things are really, really, can make a huge difference knowing that they're out there in the community and being properly taken care of and that people know how to use them.
And Kiko, would you know where to start that conversation within the town structures? I mean, I've marked off some boards here, which were mostly the school boards as I'm so school committee, Amherst Pelham Regional, and just Amherst. I'm also thinking based on what Betsy talked about, the Recreation Commission probably. But we would be talking about sports fields, bike path, schools. I think restaurants might be in a stretch, but
yeah. I mean, is there a regulation that this sports coaches, make sure an AED is available and they know how to use it? Are the public gyms required to have that?
I mean, there isn't a local regulation that requires that. I think that's something that the board could right. I don't think there's a state regulation or we'd be following it. I don't know what the rules are exactly in schools. Or I mean, in medical facility, I don't actually know what sort of policies are in place about the need to have these AEDs in certain. Does anybody know?
No, but it sounds like Betsy might have the energy to look into it. Am I reading that right?
Yeah, I think this is something that's important, and I do feel that's something I owe our neighbor and my good friend putting some effort to in the town. My good friend lost a child.
Yeah, I mean, I'm glad you brought it up, Betsy. What I like about it is it's very concrete. I think there are two prongs. Like one is that I would want to understand, are there best practices for this kind of thing in other towns? Like, are there, do you like how many of these do you put up? How sort of prevalent do they have to be? Would there be key locations? How much would they cost? You know, is there funding to support them? Would there be a grant that could support this? So that's kind of like a programmatic piece. And then there's the policy piece that would require them be in certain places. And I think it would be helpful to understand what kind of legislation or regulations exist in other places along those lines, because you want to be able to do something that's reasonable. You don't want to require something that becomes, you know, maybe for lack of a better word, an unfunded mandate. If we say you must have these things everywhere, but there's no money to buy them, then that's not a very good piece of regulation. So I think I think it's a really critical public health intervention. And we just need to figure out what the path forward is through either programmatic or policy paths.
Jack, I think you put your hand
Yeah,
up
I
somewhere
just
in
wanted
there.
to ping Betsy on what her kind of stand is on fluoride when she mentioned, pediatrics.
Betsy, you're on mute.
So I think that the fluoride recommended levels may have gone down a little bit. I do believe in universal fluoridation, but I don't know, haven't looked at whether the recommendations are for a level of fluoride that, that the town is at the kind of current best practices. I mean, I assume so, but I haven't looked at that myself for some period of time.
Okay. I was just wondering.
I do believe in fluoridation, and do think it's important. But I just, the best practices have become a little more refined, I think, in the last years. There's been some evidence that very high doses of fluoride, beyond what would be done in I'm sure beyond what is done in Amherst, can be harmful.
Yeah.
But I don't think we're anywhere near those levels. Just to make sure that we're, wherever the best practice is.
So just to provide a little context about that, I do get a monthly fluoride report. So Amherst water is fluoridated, and the Department of Public Works fluoridates the water supply and provides monthly reports about, samples that has the concentration of fluoride in it to the state. The state has standards for fluoridation. They haven't changed recently, to my knowledge. It's a very, very low dose. I used to have it written down, but I took the post-it down, 0.7 ppm, tiny amount.
Yeah.
Low dosage.
That's it.
That's it. Is that right? Okay.
Yes.
So anyway, so that's all set by the state and monitored by us. And I do get those monthly reports, just to provide that context to all of you.
That's impressive, Great. Kiko.
So we are at the time scheduled for this discussion. Where I lean on this list is probably in the walking, biking bit, and to sort of put the health angle on those conversations, because they are difficult conversations. I don't expect much changes quickly in terms of creating bike lanes and sidewalks. Those are high cost interventions. And I know the town has lots of discussions on them, but maybe just to add the health angle onto that, and I can investigate the e-bike um, issue that was raised at the last meeting to make sure I understand what those risks are and if we are, properly preventing or, doing the things to prevent harm with e-bikes. I don't think this needs to be an open meeting in terms of if someone wants to dive into something, you can just send me an email and say, this is the topic I'd like to take on. And this is sort of ideally the timeline at which I would expect to have something to discuss. So we can sort of keep slots in our agendas for those. Does that sound like a way forward if for those? All right.
Yeah, can I, sorry, was someone going to say something? I just wanted to add, I have a couple things in my director's update that are actually relevant to this conversation, so I'm going to share them now. And one of them is under the UMass connection. So I did speak with my contact at UMass about the e-bike issue that was raised last time. And there is a committee at UMass being headed up by someone that I do know, the environmental health director there, to look and with facilities and police, part of that committee to look at sort of safe e-bike and other, whatever it's called, there's a word for it, micro transport kinds of devices on campus. So I think it's good I want to reach out to them to find out more about it and see if there's an opportunity for collaboration across the town and the university on this particular thing. So that's something that I can do some research on and come prepared to the next meeting just to tell people, here's what's happening. Don't know if you all want to plug in a more meaningful way. So that's one thing. And then in terms of the gambling, there is someone that we work with really closely who is an addiction specialist at UMass and also runs the recovery meetings. So she's involved with our opioid settlement work and is a really important stakeholder. She also has some involvement in problem gambling and managing that on campus. So the next time we meet with her, which will be fairly soon, I can also find out just a little bit more about that. And again, bring it back to the board to see if it's something that you all feel you want to work on in some kind of meaningful way. But
Nico,
I think
can I ask a question?
Yeah, go ahead.
On that last point on sports gambling, I'd also be interested to understand what they're doing across the colleges. So we don't want to forget about Amherst and Hampshire. And so is this something they're doing sort of in the 5 colleges consortium or should we then pick up the mantle for the other schools? Because I do think sports betting is likely to be highest among those ages.
Yeah. Yeah. Okay. Good point.
I had an encounter with a younger college age male that said I asked him and he was actually using an app and he said, oh, and I asked him about it. I was like, he's using this particular app because it's the only one that if you're under 18, you can use. And I was looking at, and I was like, whoa, okay. So I think it's called Fliff or something, but I went there and it didn't really, it didn't really say that. And I think it wasn't even licensed in Massachusetts. So, but there was an article, I believe, recently in the Gazette about one way to check it is to kind of limit the bets to be of a smaller size. But I'm glad we're taking it up and reviewing it.
Okay.
Great.
Okay, so I'll keep you posted on those 2 things.
Thanks for those, Kiko. So moving back to the agenda, I think the next item would be the director's update.
Yep. Okay, so just so everybody knows, respiratory illness, it's a really bad flu season. I told you all this. We predicted it last meeting. It's come to pass. I hope you all are staying healthy. Public Health, Maheen and I today were working on an update that we're going to send out through the In the News feature on the town. So if you subscribe to those messages, you should get a phone text message saying, latest from public health, click here. So then you'll get brought to the website where there's all this information about respiratory illness. And we've also put together some tips just for staying healthy during the winter. Maheen did a nice sort of infographic that will be on the website. It's also on our bulletin board here at the health department. So just all that to say, vaccination rates are terrible nationwide for both flu and COVID. They've been declining steadily, and they're at an all-time low now, whereas this flu season is the worst in 6 years. And last year's flu season was pretty bad too. There have already been 3 pediatric deaths from flu in Massachusetts, at least deaths that were associated with flu this year. And childhood vaccination rates for flu are, again, lower than they've been. So this is not surprising in light of what we are experiencing in terms of shifts at the federal level. I think one thing for you all to consider too as possible work for the future is that we are really encountering a lot of challenges with vaccination, with changes to the guidance. So the CDC just released a new guidance for childhood vaccination, completely upending what we've been using for the last however many decades. And I think we're waiting for Massachusetts to issue probably some statewide recommendations from the DPH that might be different from those federal guidelines, then that will drive what happens with Massachusetts insurance companies and what we can do here in public health. But we're in this sort of limbo period right now, and it's kind of unfortunate given what's going on with what we see, these vaccine preventable illnesses, measles, not here, but in other parts of the country, flu, all-time high, that type of thing. So it's just, I've mentioned before that there's this website that we're working on. It's been hard to find the time for it, but it's very close to being done. And by February, when we meet again, it will have launched. So I'm making that promise because I want to make sure that we get it done. And it will be a place where people can go to get the most up-to-date information because it is super confusing and it's changing all the time. So just again, if you all can keep an eye on that, I'll send things your way. If it seems like there's something that Board of Health can do, I think the Board of Health being a voice of understanding of reason when it comes to, promoting vaccine and increasing access or allowing access to vaccine for people in our community. I think that's an important role for the board just to support and be a spokesperson for down the line. So more to come on that. The other thing I was going to tell you, if I haven't already, is that the Bangs Community Center, where we have our office and where we've had some meetings, is under renovation as of this week. So it's going to be a year-long process. It's mostly infrastructure improvements. They're doing, the HVAC system needs to be replaced, sprinkler system, things to keep the building safe and up to code. And then there'll be some improvements that will be made on the first floor where the senior center is and where public health is. So that means that public health is going to be relocated. We'll be moving to the second floor, probably in the fall. So our offices will not be at ground level, we'll be up a staircase. I think it'll mean that it's going to be a little harder for people to find us, but this is what's happening. So just a heads up that if you can't go to the basement of the Banks Community Center right now, it's off limits. They're working on the basement now. When they finish that, they'll move to the second floor, and eventually they'll move to the first, and we'll move up to the second. So it's going to be a little bit chaotic over here at the Banks for the next year, 15 months, I would say. The other thing I really wanted to let people know about is, and Risha and Betsy, you know that you are in this web EOC database. So, and that's for emergency preparedness in our community. So there is a coalition called the Hampshire Public Health Preparedness Coalition that is an emergency preparedness coalition for the region. It includes 21 communities in Western Mass, North Amherst, Chesterfield, Williamsburg, basically the contiguous communities in this area. And there's a certain amount of funding that comes down from the feds through the state. It's managed by something called the HMCC, which is the Health and Medical Coordinating Coalition that is part of FERCOG in Franklin County. They're the pass-through for this money. But essentially, there's about $160,000 in emergency planning money that comes to this coalition, this Hampshire County Coalition, every year. It's been run for the last 14 years by Northampton. And Northampton recently withdrew from being the contractor, running the meetings. So there's been sort of a lack of leadership. For the last 6 months, it's been without a chair and it hasn't been meeting. So I sort of stepped into the void and said that I would help to get this coalition back up and running. So what that means is that the group will start meeting, and it's really just to practice what it means to be prepared for a public health emergency like a pandemic or flooding. What are the public health aspects of emergency things that can happen in our community? Are we prepared? Do we know where our shelters are? Those kinds of things. So it's good to have Board of Health involved, and that's why 2 people from the board are on this database. The database is really just that, a database, but it's also a communications platform. So if there were a major emergency and there was something that needed to happen, Risha and Betsy, you'd be getting some alerts through this system. You'd text messages, something like that. I'd be calling you. It would be a way for us to communicate with each other. In the meantime, I'm going to be running this coalition for the next 6 months to try to get it back together, figure out how we can spend the money that's been allocated already for this year, which is half over because it's a fiscal year. So the first 6 months are over. And then from there, who will be leading it? What role will Amherst play? Will Northampton come back into it? These are all questions that we don't have the answers to right now. So, but it's just something for you to be aware of, that it is, if there were a public health emergency in our community, the Board of Health would be part of that, would play a role in that somehow. I don't know exactly how, but we're going to be working on thinking about that in the next couple of months. So just heads up about that. Any questions or concerns?
I mean, I received your email about it, and I will be attending the meeting you called.
Oh,
so
that's great, Risha. Thank you. And Betsy had also asked about it, and I really said that there's no expectation that you attend if you're not able. I think it would be great for you to attend to become informed, but I can certainly represent, but if you can make it,
Yeah.
I really welcome that. Thank you. It's great.
Well, thank you for taking that on. I'm going to be on an airplane at the time.
Right.
So I can't participate, but I thank you for stepping up to the plate on that.
Thanks, Risha. Sure.
Kiko,
that was Betsy.
Go ahead.
Kiko, the municipal vulnerability plan, I can't even speak, sorry. Are there opportunities to kind of like for the Board of Health to cross-reference within that? Because you're right. I mean, it should, but I got a feeling that these MVPs that are, a lot of the towns have done may not speak to what you're talking about.
So is that different from the hazard mitigation plan? There's so many different kinds of plans with different names.
I think that's a part of it.
It's a part of it.
That's a part of it. Yes.
Okay. So I think that there's sort of an umbrella. There should be an emergency management plan for the town, and the fire chief, Lindsay Stromgren, is the emergency manager for our town. But public health really supports that. So there should be an emergency management plan, and then underneath that are efforts that are sort of more focused on specific health aspects. And that's what the Hampshire Public Health Preparedness Coalition is for. So in an ideal world, all these things should be connected. And I think that we have some work to do to make that happen. So
yeah,
it's definitely going to be some time to make everything streamlined, but you're right. All of these things should be linked. Couple other quick things. I'm going to send to all of you tomorrow an email about the conflict of interest training. So that's required for all town staff, have to do a conflict of interest of training once a year, and all people on all town boards and committees also need to complete this conflict of interest training. Do any of you remember doing it last year?
I remember doing it at some point.
At
Was
some
it last year? I don't know.
Okay, but you've done it before, so this isn't a surprise. Okay, so I'll send you this email. It needs to be done by mid-February or early February, so I'll send it to you all tomorrow. So just keep an eye out for that. What else did I want to tell you? There's been some changes at the town council. There's a new town council president, if you've been following the news. So Lynn Grissomer is no longer the president. It's now Mandy Jo Henneke, and Alicia Walker is the vice president of the council. So Mandy Jo sent out an email today asking if boards and committees wanted to request a liaison. So you remember that happened before, and before the board had a chance to answer, we were assigned a liaison, which is unusual. That doesn't normally happen. It's at the board's desire. If you want to have a liaison to the town council, we need to let them know. So I will also forward that email on to all of you. It was requested by Mandy Jo that we do that as liaisons to boards and committees. So I'll send on the email and you all can consider whether you want a liaison, or we can talk about it for a second here. Risha, I don't know what you prefer.
Yeah, I mean, last year we were assigned one. And it said in that email that that Mandy Jo sent today, that the Board of Health is already sort of assigned one. So I'm not sure there's anything for us to discuss.
Okay, maybe I didn't read it closely. I read the email to say, if you want one, let us know. But
it did, except it had a list of those that already had them.
I think that was boards that were assigned one in the past. So we were assigned Pat DeAngelis before, and she's no longer on the council. So that means we don't have a liaison. Yeah.
Okay.
Right.
Okay.
Yeah. So since we don't have a liaison currently, or you all don't have a liaison, it's something that you can opt to have or request to have.
Yeah, I think last year, I mean, we have the same people on the board as the last time we discussed it. So I'm suspecting not much has changed. Obviously, correct me if I'm wrong, but I think we were sort of leaning towards no. And then one was assigned. It is obviously great to have a connection to the town council. The question is just, is this the way that do we need someone assigned to us, or is it something that we can just pick up a phone if something comes up and we want involvement? I know that Pat attended some of the conversations we had on the trash pickup, and so that was helpful. But she was also, I think, part of the committee that had dealt with it, so she was serving dual duty there. So I remain unclear on if it's a value add or if it's something we could just reach out and do as needed.
I can do a little asking around about that. My sense is that it's helpful to have someone who's designated. So just picking up the phone and calling if you need a connection to town council might be harder. Whereas if you have someone who's assigned, even if they don't come to every meeting, it's an entry point to a connection between the Board of Health and town council.
Yeah.
Which could be helpful. So I'll send the email and I'll ask around. And my guess is that, anyway, we'll see what happens from there. I think it might be helpful. So
I guess we can't respond all to that email because that's open meeting law. But I mean, for what it's worth, from my standpoint, I would be happy to have one.
Okay.
And I'm happy to put an ask out. I don't have any purpose for the person
right.
or in mind, so I don't want to take them away from someone else that does.
Okay. Does anybody else have another perspective on that? Anybody else on the board?
Yeah, I think I mean, I'm thinking, okay, information go through you to Paul, and then Paul presents the opinions, or it can go to a council person. I think either way works for me. Whatever is easiest for you, I guess. And it sounds like you think it, from your perspective, I think we should honor that. But
okay.
Yeah.
Okay, great. Because I think it could be helpful.
Mm-hmm.
Thank you. All right, I know we're running out of time, so let me just say two more things. One big piece of work that's coming up for everybody in local public health is compliance with SAPHE 2.0. So that's SAPHE. It's the public health excellence work, the blueprint for public health excellence. It's the work that's been done over the last 5 years to build regional capacity. So we have a shared service arrangement with Northampton. They're the ones that help us with vaccine clinics. They help other communities in the cohort with inspections. We don't need that help because we have our inspectors, but it's the idea that not every community in Massachusetts has access to the same public health infrastructure. So every couple of years and there are standards that they're setting. Standards are being set that local public health needs to meet over these next couple of years. Folks need to be trained, policies need to be in place, procedures need to be developed so that a certain standard of public health can be met regardless of whether you're in Boston or Middlefield. Within to, within reason, right? So this is a huge chunk of work. We're going to be getting these surveys that we need to fill out. Both all of the staff, Maheen, this is also for you. We'll be getting a workplace assessment survey where people will need to fill out what background they have, what gaps they have in knowledge, so they can get in a sense of how well trained the public health workforce is. And then there'll be other surveys about standards and whether we're meeting them and what needs to happen to meet them. And so I don't envision an actual role for each of you as individual board members in this, but this is really about building our public health infrastructure in Amherst. And you are a critical piece of that public health infrastructure. So I feel like it might be helpful to have someone come from DPH and present about this, talk about how boards have been engaged, get you all up to speed on what this public health excellence work is and how other boards maybe have been involved in other places. It really depends on how big your community is in terms of what the Board of Health involvement is. And I know I've talked about this with you all, but my sense is that and we don't do a lot of that in this meeting, have presentations just about programmatic stuff, but I wanted to put that out there as something that might be a good use of time in one of our meetings, is to have someone come and talk more about that work. What are your thoughts about that?
My 2 cents is I'm all in for it. I'm feeling like this is the big gap for us now, particularly now that we don't have sort of things, beating at our door that we have to deal with in terms of policy amendments. I don't understand where we have influence, what levers we have, and how other boards are working within that, how we connect with the state. And so I think it would be really helpful. I'm also happy to do that on my own if it's not what people want to use the board time for.
I think it has the potential to be really helpful, so I support it.
Yeah, I mean, I really feel like it would be helpful to all of our work because this is the future of public health in Massachusetts, this piece of legislation and all the work and programming that flows from it. And I think getting everybody together on the same page, understanding this would be very valuable. So I've heard from two of you. Betsy, maybe you're in the Redwoods by now, or you are there. Okay.
I am here in the Redwoods, but yes, that would be fine. I do think that makes sense.
Awesome. So Jack, I hope you also think it would be good. Because I think it's important.
Yes.
So good.
Sure.
So then I think the question would be, and Risha, you and I can talk about this more, like maybe we do it in March if you want to make sure that we get all these other pieces finished up in February. But I think the spring would be important because a lot of these surveys are coming out spring or late winter, spring. And so I think it's timely for the board to be well informed about this. So more to come on that. And then the final thing is, as you all know, we still have a vacancy. We don't have any current applicants right now for the seat that I'm aware of. So I'm going to meet with Paul on Friday and see what else we can do to recruit folks, but just putting the word out to you, if you know of people that you think would be good board members, keeping in mind some of the things that we've talked about in terms of what we'd like to see as a representative board, a board that's representative of our community. Just saying that I welcome suggestions. So, and I think that's the end of my update.
Okay.
Goodbye, everyone. I'm going to sign off now.
Okay.
Bye, Betsy.
Any topics not anticipated by anyone? Doesn't look like it. So we do have time for public comments. And I see two. Okay, so I was just pausing because I know Melody's hand's been up the whole time. And so I hope she's still there and ready for us to move her into the on-screen panel. But we will. So 2 minutes for each public comment, and please do say your name and where you're from.
Hi, how are you?
Good.
My name is Melody Wolf, and I am from Kalamazoo, Michigan. And why I dialed into this meeting is that I was the person that participated during the HHS FDA press conference on Kratom and 7-OH. I was welcomed to the stage by FDA commissioner. They asked me specifically to talk about the benefits of Kratom. As an 11-year daily consumer, and February I will be a 12-year daily consumer. So I understand why, looking at their website, you might be a little bit confused because regulations or statements take a long time. But I think that just my presence on their stage, that they personally invited me, that kind of shows what they think about unadulterated kratom. And your city has the ability to mirror what the FDA has. You could get rid of 7-OH, ban it immediately. I support that. And keep the unadulterated products available for people like me who, without it, have to use a walker or wheelchair. In 2022, because of Kratom, I was able to care for a newborn for an entire year, my granddaughter. And then this past summer, I was asked back again to chase a 3.5-year-old all over the parks all summer. And I just would, excuse me, really encourage you to keep Kratom legal and to get rid of 7-OH, because at the University of Florida Research Center 2025 Scientific Symposium on Kratom, there were regulators and scientists from every agency in the US, as well as from around the world. And they exited that conference saying, keep it available to consumers right now, put an age gate, get rid of the 7-OH, ban that immediately, and have it tested like any other supplement, such as valerian, which you can buy at Walgreens. And the FDA doesn't approve that for medicinal use either. And so I just want to hope that you would keep the plain leaf products available. Thanks for your time.
Thank you.
Okay, I'm gonna call on Laura Romney.
Hi there. Can you hear me?
Hi. Yep.
Great. Hey, so I'm Laura Romney, and I'm a patient advocate, and also I'm with the International Plant and Herbal Alliance. I work really closely with a lot of localities helping with education. I actually was one of the individuals that was on the education that educated Northampton. We've also educated at cities like Fitchburg as well. So it's, again, I just want to say that we are offering that to you as well. We can do, on another meeting, or we can just do a separate Zoom phone call. I promise, should be worth your while. The one thing I know that I listen to specifically is you're worried about trying to differentiate between the difference between 7-OH products and natural plant kratom. I think it's a great idea what you guys are doing to go out into the stores to see what's actually being sold. I bet you will be surprised and shocked that the majority of what is being sold on your shelves is the synthetic products. It's actually easier than you think to determine the difference. Don't just look for the word that says kratom on there, because they will actually mark it as an advanced kratom alkaloid. So you would just need to actually look for that 7-hydroxymitragynine or pseudoindoxyl. So again, I just want to say that it's not just 7-OH that's being sold out there. These greedy, I call them greedy manufacturers, are coming up with more and more ways to create these new novel synthetic products. And so what I highly suggest is that you, again, I'd be happy to send you some examples of both natural kratom products that are properly labeled and that are the safe products versus the synthetic products. So you can actually see it's really not difficult to distinguish the two. We're actually expecting the DEA. Rumors are that this month sometime they will be coming out with their final their message that Schedule 1, or that 7-OH products will be Schedule 1. So this is going to happen. But again, I just would tell you that it is easy to do. It's not hard. I will be sending you some information to help you delineate between the two products. And I'd love to have you send me some photos of what you're seeing on your shelves, just to try to help you understand what's really being sold, so that you guys can set proper proper regulations, because just like Melody said, it's just critical that you leave the whole plant for availability, because people like myself, I mean, I know she talked about a wheelchair, but I have trigeminal neuralgia, which is a severe facial nerve disease, and I would not be functioning without it. And it's near impossible for people these days to get any sort of pain medication. And so it's super critical that people have these alternative options out there so that they can, they can function in society. So again, I'm happy to answer any questions. You have my phone number and my email, but I will be sending you some pictures and photos so that when you go out into your cities, you can kind of see what's being sold. And once that's done, I would be happy to work with you on coming up with a really great, regulatory framework to be able to, get a great ordinance in place that can kind of be the, I'd say the star of Massachusetts, because you guys would be one of the first to really do it right and show the other Board of Health's the best way to do it and pave the way for Massachusetts to pass the Kratom Consumer Protection Act, which is one of the active bills that are in the state. So
Thank you.
appreciate your
Laura.
help. Thank you
Yep.
so much.
Take care.
Thank you.
Okay, next I'm gonna call on Jennifer Gillis.
Hi, how are you doing? Thanks for the opportunity to speak tonight. I'm not going to take too much of your time. But 20 years ago, I was diagnosed with transverse myelitis, and I became a lifelong chronic pain patient. And after losing access to my prescription medications that I'd relied upon for so many years through no fault of my own, I spent years just struggling with chronic pain. And I found Holy Kratom powder 6.5 years ago, and it's given me my life back. So, and I know that there's so many people out there that are in the same boat I was 7 years ago. And, they should have the option to be able to, benefit from Kratom if they so choose. But I think it's a good thing that y'all are going to go out and kind of look and see what you have. Like Laura said, a lot of the, 70H packaging will say, they're really flashy packaging, and Holy Kratom powder is literally tea, like leaves from a tree that have been ground up, and it's like a powder. But yeah, anyway, thank you so much for your time. I just wanted to put my 2 cents in, and hope y'all go towards regulation instead of banning it all.
Great. Can you just say where you're from?
I'm from Tennessee, and I'm just a normal old person. Actually, I because Kratom gave my life back. I've used my time to advocate to keep Kratom legal for everybody across the country who's either benefit from it now, or they haven't found it yet. And if it stays legal, they may in the future.
Great. Thank you.
Okay, next we have Brianna and Michael.
Hi. Oh, it must be underneath. Okay, I'm underneath another laptop. I'm sorry. Good evening. My name is Shannon, and I'm a lifelong resident of Massachusetts. There are a lot of people right here in Mass as well as myself. If we lose access to whole leaf kratom, it's actually terrifying to even know that people will suffer in pain. If it's totally banned, and it's not just our state, but a country as a whole. The chronic pain that I experienced before I found whole leaf kratom, I can't even begin to even explain what I went through. I am a healthcare worker. I'm a CNA home health aide. And, I can't imagine trying to work and, do my job in total agony. I have chronic lower back pain. So please, instead of banning whole leaf kratom, even, looking into regulating it. And I do totally support ban on the 70H. I also did email you recently as well with my success story and some info on whole leaf kratom and the synthetic 70H. Thank you. I appreciate your time.
Thank you.
Thank you.
And can you say what town you're from in Massachusetts?
I'm in Somerset, Massachusetts.
Okay, thank you.
Thank you.
I'm not seeing any more hands at the moment. I'll wait. Nope, I'm not seeing any. So with that, we will close the public comment. Thank you all for making those comments. And with that, I think we are at the end of the meeting. If somebody wants to make a motion to close the meeting, unless there's anything else.
So moved.
Seconded.
All right.
Thanks,
We'll
everybody.
see you all next month.
See you in
Bye-bye.
February. All right, take care.
Thank you.